Welcome to my YouTube channel. My name is Deborah Kiboma and my co-host today is
Vyas.
Thank you so much. And our guest today is
My name is Dr. Bharath Vyas. I'm a consultant physician and a specialist in cardiodiabetology.
Okay, today we are going to talk about depression, and as you all know, depression is something that has affected so many people, not only young but married people. Recently in my country, Kenya, there are people who have come up with this situation that a husband and wife, they kill each other just for nothing. So today we are going to talk about depression and see what's depression, why people have depression. Yeah, welcome.
And also, maybe if you forgot,
Yes.
I think there are a lot of people who are in mental hospitals.
Yeah.
And today that's why we want to address this issue with Dr. Bharath, because it's a raising issue. People have mental problems, and of course, for the fact that in Africa we have a major problem where we don't identify what depression is.
Yes.
So we are going to understand this with Dr. Bharath. Thank you. I hope you'll be with us till the very end.
Yes.
Very well. To understand depression, first we have to understand what types of depression are present. Okay.
Yes.
There is unipolar depression, in which there is only depression, and there is bipolar depression, in which a person is depressed at one time and totally excited at other time. Okay, these are the clinical types of depression.
Yeah.
Again, in depression, it can be because of multiple causes.
Yes.
Okay, it could, most of the time it is genetical in nature. People who suffer from depression, they have a family member, they have a close blood relative who must have suffered from depression. So knowing the family history of the client is also very important when identifying depression.
Yeah.
And one more thing is that depression can be because of multiple causes. Most of the time it is because of the familial issues or career related issues or financial issues.
Yeah.
These are the ones which cause depression.
Yeah.
Okay, but it can happen to anybody.
Yeah.
But there are some set of individuals who are more prone to depression than the others. And as I told you earlier, it is mostly genetical in nature. Some people are more prone to depression, others are not.
Yeah.
Okay.
Maybe, Dr.
Okay.
Bharath, before we go to types of depression,
Mm.
I've discovered that, of course, there's people don't know the difference between depression and stress.
Yeah.
How could you distinguish that?
Depression usually has low mood. Okay. And inaptitude. That means they are not interested in anything. Their mood is always low in nature. It is very difficult to define depression in colloquial terms. But involution means they don't have an urge to perform any regular daily activities. And low mood, people, they don't want to do anything, they don't want to talk anybody. And then mutedness and emotional bluntness. Emotional blunting is, for example, if there is a exciting situation, they don't get excited.
Yeah.
If there is a happy situation, they don't get happy, interested. And if something wrong happens, their reaction is not appropriate to the quantum that is expected of them. Okay, these are all the features of depression.
What about stress?
Stress is different. Stress need not cause depression. Okay, when you are stressed, maybe you are mentally tired or physically tired, but if something happens to you or something happens to the close ones of yours, your reaction is appropriate to the amount of injury or amount of the harm that is done.
Yeah.
But people who are in depression, their response is not adequate enough to the particular event. You see?
Yes, but I think it's just the same, because you can have stress, then I have depression. I don't feel like talking to you. You have stress, you don't feel like talking to me.
No, the stress should not be confused with depression. Depressed people are typical. You can find depressed people that they are depressed. Whereas stressed individuals, they become alright. Maybe after few minutes, or if they are relaxed, they become alright. For depressed people, they don't become alright for days together, months together.
Do you think prolonged stress actually leads to depression?
Yes, prolonged mental stress can trigger depression. Stress can be a trigger of depression, but stress is not depression.
Okay.
Is it right to say that depression is an illness just like any other?
Yes, depression is a disease. It has to be treated as a disease. Any person, for example, with fever, what you do, you treat them. The same thing applies to depression. But the most of the time, what people do is, this is just depression. What is there? I'll get all right. You see, most of the time the people tend to either overlook it or they treat themselves with, say for example, with alcohol, some people with drugs, some people with smoking. Okay, so this is the main problem with depression. It is like standing in the middle of the ocean and trying to catch your head and lift up. Can you do that?
You
no.
cannot.
So most of the people in depression typically try to do this. That is why people suffer from depression for a long time. It is underdiagnosed, most underdiagnosed disease in the world. According to World Health Organization, more people suffer from depression than it is noted in the statistics. It is most under recognized and most undertreated problem in the world.
I usually wonder if kids from the age of 4 to 10 can get diagnosed.
Yes, anybody can be depressed.
Why?
Yeah.
Why a kid of 5-year-old kid?
Because of the chemical imbalance in the brain. You see, there are certain what you call brain hormones and brain chemicals which actually trigger depression. Yeah.
If depression is a disease, as you say, that means it has symptoms, right?
Yes.
What are the symptoms?
That is how we actually understand depression. Okay, involution. Okay, person not having any interest in doing anything. Okay, the will is absent to do something. Okay, involution. Emotional blunting. Emotional blunting means the emotional response to various situations in life, they are not appropriate to the particular situation. Okay, then pathological obsessions. Okay, everybody has obsession, but these particular people with depression, they have pathological obsessions. Like for example, if they want to for example, I like painting. I paint, or you also can paint. But these people, they will be painting only throughout. They will not be interested in doing anything, even though that particular obsession of them is causing harm to them. Like for example, they may be losing their livelihood, or they may be losing their interpersonal relationships. Okay, these pathological obsessions. Okay, then what you call even some people have some people behave catatonic. Like they don't talk, they don't speak, they don't respond to anything, they just sit like this. Okay,
they become mad.
Don't say mad. Mad is not a polite or right term to use, but they look as if they are totally disturbed. See? And even the physical upkeep, like they don't shave, they don't bathe, they don't even brush their teeth. Okay, all these features are supportive of depression.
I think when you say they don't bathe, when someone is depressed, this person doesn't feel like doing anything totally. He or she doesn't care about what happens to his body or her body.
He gets lost in his own thoughts. Most of the time what happens in depression is self-guilt. Okay, they'll be inside they will be scolding themselves, they will be cursing themselves. Outside they put up a brave picture. Okay.
Perhaps, doctor, because it's a disease, that means there are stages. What are the stages?
Depression is more of a continuum than stages. Okay, it's more of a continuum. There are no clear-cut stages. Okay, a person may look okay, but on interview, we doctors, especially the clinical psychologists and psychiatrists, when they interview the patient, then they will know how severe it has affected their mental process.
Therefore, that's right to say that there is no first stage depression and end stage depression.
There is nothing like that. Depression has to be treated as depression, but the severity of depression can be gauged by various scientific scales that we employ when we are diagnosing patients.
And can someone, let's say someone is depressed and she has become, she doesn't know ideally, she doesn't understand herself.
Most of the people, they don't understand that they are depressed.
I think I don't know which term I can use apart from being mad a bit. She develops a mental illness. She goes to a mental hospital. Then I think there is a last stage that can show you that this person, I think now she's okay.
Most of the depressions can be treated. Only thing is that treating them is difficult. Okay, most of the psychiatric methodology of treating any mental disorder is to put the patient in a controlled environment. Okay, putting a person in controlled environment, people, especially the patients themselves, they think as if they are jailed. Okay.
Yeah.
In most of the psychiatric institutions, we place a person in hold. We don't let them go out of the institution.
Yes.
Okay. When we do that, the patient thinks that they are jailed, but actually they are being helped, because we are observing a patient in a controlled environment where there is no harm to himself or herself. At the same time, there is no harm to others because of their aberrant mentation.
Yes.
Okay, because they tend to do crazy things. So to prevent that, we keep in a psychiatric hold. But even many a times relatives also think, the relatives of the patients also think that this person is being locked up. It is not getting locked up, but it is actually helping the patient to prevent harm to himself or herself and also to the others. And also this is a form of a meditation actually. You know, psychiatric hold is a form of meditation. Meditation, what you do, you sit at one place and think about yourself.
Yes.
Okay, the same thing we are forcing in a mental institution. Okay, but if many a times the defensive response of the patients are that I can do it for myself, why are you holding me?
Yes.
Okay, but that is not right, because you are unable to understand you are unable to gauge the situation actually. You are neck deep in the ocean and you are trying to lift yourself up by pulling your hair yourself.
I love watching movies, and when I see someone who is depressed on a movie, they always have a lot of energy. They can harm themselves and they don't feel any pain.
Yes.
How does that come?
It actually happened. We had a patient, young boy, who was depressed. So we put him in the he was depressed because of the substance abuse. He was abusing all kinds of drugs. Okay, he was taking sleeping pills, he was taking MDMA, he was taking crystal meth, he was smoking weed. Okay, so that substance abuse actually put him into bipolar depression. Okay, so the father got the patient here. We tried to sedate him. We gave something around 20-30 injections, but I was unable to sedate him. He was in manic phase of the depression. Okay, and he even broke a door.
Wow.
He broke a door. I was trying to pin him down and he broke a door. I had to tie him up that night. The next day, everything gone, all the energy gone. Okay.
That's quite shocking.
Yeah.
Is it like all cases of depression are
No.
sent to a mental hospital?
Depression should be treated by an expert, because an expert knows what is happening actually. The first place to go is to visit a psychiatrist, because there are not many psychiatrists around. I often do take cases because I myself suffered from depression once upon a time. So I understand how painful it is, how traumatic that is, how traumatic to the whole family it is, I know. So I try to help people with mental disorders, especially bipolar depression people and unipolar depression people. I do treat them.
What about now in Kenya setup? I believe that you've been in the country for some time.
Yeah.
Do you think Africans or Kenyans, for that matter, have come to the fact to agree or admit that actually depression does exist?
Yeah.
Do you think parents and the age of...
Unfortunately, it is being recognized later. Of all the patients we have treated, most of them they came in bipolar patients we have treated, many of them actually, and many of them came in bipolar mania. Till the patient becomes manic, they don't even realize that this particular person is getting depressed. You see, that is one of the factors of that being, you see, Kenyan men tend to be polygamous. I think that is one of the main important factors. You see, they produce kids with some 2-3 women, and the kids, they feel left out.
Yeah.
So the family balance is lost. You see.
Therefore, claiming that you have depression is not attention seeking, right?
No.
There's a joke in the internet that I've seen, and maybe perhaps you should shed some light to it. They say that depression is more of to the rich people than the poor people.
No, anybody and everybody can be depressed, and actually even normal people do get depressed, but that is not lasting. When this getting depressed is not a abnormal thing. When something bad happens in life, everybody can get depressed, but when this depression lasts more than a week, more than a month, that's when it is pathological, and it has to be addressed, and it has to be addressed by experts.
I think anyone can get depressed, whether rich or poor.
Yeah.
When was depression finally acknowledged by the WHO as an illness?
Long back. Actually, there is something called DSM. It's a diagnostic manual for understanding psychiatric diseases. So in that there is a classification. There are numbers for various diseases. You see?
Okay.
Yeah.
There you say there are medical ways of treating depression.
Yes.
But when one time I also happened to be in that situation of depression, at some point I visited a psychologist and said, she said to me, we can give you all kinds of medication, but you're the solution to this.
Yes. See, most of the mental diseases, especially types such as bipolar depression or unipolar depression, most of these things are caused by what is called ego. Can you understand? Do you know what is ego?
Ego, yeah. Maybe it is having so much self-pride.
No, self-pride is not ego. People don't understand. They misinterpret the term ego. Okay? You can't see your face. Can you see your face yourself?
No.
You need an aid. That is your mirror. Okay.
Yes.
So inside the mind, what you are, how you perceive yourself, is through your ego. Your ego is the mirror which shows you what you are.
By the way, you know, when you look at a mirror, you see yourself. But when you get out of the mirror, your mind will always remind you of how you look.
Yeah, your mind is the one which is showing you, na?
Yeah.
How are you perceiving yourself mentally?
You know how you look?
That's what ego is.
That is what is ego.
So
Okay, what happens is this ego is built over a period of time. Okay, usually kids, they don't have ego. When you are born, we don't have ego. We don't perceive ourselves. We only perceive our environment. Okay, over a period of time, as we grow old, we slowly build ourselves a mirror to look at ourselves. And this mirror is formed by our interactions with the people, our experiences, our thought process. So various factors go into the construction of the ego. Okay, many a times as we are entering the puberty, we think that we are always right. Okay, it happens with 90% of the people. True. Whatever I do is right. I can't do anything wrong.
You always think.
Okay,
so that's ego.
So that is ego. You see, and this ego is built every day and destroyed every day. Okay, it is built every day. It is destroyed every day. Our negative experiences shatter it. Our positive experiences reinforce it. Okay, what happens with some people is this: despite having negative experiences, okay, so doing something wrong, it has caused harm, but they don't destroy that part of their brain. Okay, despite having negative effects, they keep on continuing with the same thing, with the same set of beliefs. They don't destroy those beliefs. So that leads to a pathological behavior. Okay, that leads to ego. When you do something wrong, automatically you will get hurt. Okay, but despite getting hurt, you believe that I am right. Okay, so this keeps on pounding you, and this leads to depression one day.
Okay.
Yeah.
What is the difference? Does it mean that people who are narcissistic, does it mean that such people are more likely to be affected by depression?
Yes, narcissistic people automatically. Actually, narcissism is the result of depression.
Maybe
narcissism is the result of depression, and again the narcissism can lead to depression. Both are interfeeding each other.
Just for the sake of the viewer, maybe you tell them what narcissism is really.
Narcissism is self-praise. Okay, whatever I do, I am right. Okay, narcissistic people tend to give more importance to themselves than others. Others are nothing to them. They may act kind, but they are not actually kind. Okay, most important thing is them. Me, that is narcissistic.
I'm always right.
And the second thing is that their choices are also illogical. Okay, because I am right. Actually, we had a person, we had one of our colleague who used to suffer from narcissism, and we suffered a lot because of that.
you know, when someone thinks, let's say I think I'm always right, then you can't tell me that you're not right. I will always think that you don't like me.
They used to think that, people with narcissistic tendencies think that they only know everything. Nobody else knows anything. They are the experts in everything. Everything under the sky, they are the experts. That's how they think. No matter how illogical they sound, it doesn't sound illogical to them. The problem is not, as a person they are not bad. Their mentation is altered. They have developed some concrete beliefs which they don't want to part with. In fact, telling themselves that you are wrong is very difficult to them.
Wow.
Okay, so what happens is this ego builds over time, and if this pathological the pathological thinking and pathological thought process, when they continue, they build up inside and they have lot of mental pain.
Yeah.
Okay, that's why in psychiatry, in psychology and psychiatry, we do an exercise: thoughts, feelings, actions. Okay, your thoughts are real. Okay, your actions are real, but not your feelings. You see, can you show me pain?
No.
Can you show me happiness?
No, but I think you can show someone happiness by smiling.
You can smile,
but inside you,
what is happening
something
inside
is
you?
hurting.
Obviously, that's not happiness.
Yeah. So you feel happiness, but you cannot show it because it is something inside your mind. So you have to understand the difference between thoughts, feelings, and actions. Okay, your actions are real. What you see is real. You see?
Yeah.
Are thoughts real?
Yeah.
Thoughts are real.
Thoughts are real. You are the one who is initiating them. You are the ones who's this what you call thinking it.
So that means whatever I think is real to me.
It is real to you, not to me, but. Okay.
But to you,
What speak? That's what there is an adage, na? Okay, actions speak louder.
rather than words.
Actions speak louder than words. So action is the reality. Actual reality is the action. What you are doing is the reality. Everything else is in your brain.
So everyone has their own realities.
Yes.
I wanted to take a
So
short break.
that reality of yours should actually reflect the reality of others also. That's when you are in sync with society. When your reality becomes real to you and virtual to others, that's when people stop suspecting you or people start not believing in you.
It's like a dream. What you dream to become. You
It's an
dream to
amazing
become a
discovery.
doctor mentally, but in real life you are not.
Yeah.
Let's just take a quick break and
Yeah.
then we'll be right back.
Yeah.